All right. So next, I would actually like to take a peek at the kidneys. So I'm doing right now. I'm kind of just caudal to where I was before with the spleen, and kind of coming up under the rib cage. Kidneys can be pretty far dorsal. I mentioned before I like to do my images in lateral recumbency. I feel like this way I can get a better image of each kidney. If they were in dorsal recumbency, sometimes it's a little bit harder to get that really nice image of the kidneys. So if I was looking at this kidney right now, this is a nice sagittal view here where I could pause this. You can measure your kidneys. All right, I can pick kidney. This is the left length. And I could come over here and get a good length of the kidney. Yep, yep. Do it like that, and it'll save all my stuff on there. So about 4.5 centimeters for the dog. We don't have good length normals in a dog just because there's so many different breed differences, different sizes of dogs and stuff too. There was a recent article, I forgot exactly when that one came out, looking about kidney sizes and actually comparing it to the aorta diameter. And you can actually get an aortic diameter ratio like a 5.5 to 9.1 would be normal. So kind of looking at the aorta as more of a standard on there. All right, so here's my nice sagittal view. So long axis view, kind of get this nice kidney being shaped. So let's talk about some of the different areas of the kidney and kind of remember some of our anatomy. We've got the outside area is going to be kind of like a middle echogenicity, or kind of right between being hypo or hyperechoic is that cortex. So the cortex is going to be the outside of the kidney. The middle of the kidney next is going to be the medulla. So we've got this hypoechoic medulla. We've got these hyperechoic kind of diverticuli kind of coming through there to kind of separate out our kidney into different sections. And then right in the middle of the kidney is going to be a really hyperechoic area, the renal pelvis area. So there's a lot of fat around the renal pelvis, and that's what makes it really hyperechoic. So when I'm coming here, I want to, again, in that long axis, I want to making sure I get every plane. So all the way from one side, come back all the way around to the other side and get the whole thing. Once I've gotten the whole thing, I also like to get a good transverse view. So instead of that kind of long bean shaped view, I'm going to get a more transverse view. And now I can look at the cranial pole and come down all the way to the caudal pole and making sure I'm not missing anything that way. When we're doing this, let me get a little better shot here, change my focal point, a little bit more superficial on here to clear that up a little bit. We can start looking for the renal pelvis because we do see some diseases where we'll get some renal pelvis dilation, or with fluids, we're going to get some renal pelvis dilation. So a lot of times we like to get a measurement of there. So the renal pelvis is just going to be the area, kind of like collecting system right before it goes into the ureters. So it's going to be a very thin kind of anechoic region. Kind of say it looks like a clown face occasionally right there when we're looking at that renal pelvis. If you're worried about a pyelonephritis, a lot of times there's some pylectasia or dilation of that renal pelvis. Most of the time it should be like 2 millimeters or less. So it's going to be a really, really thin kind of black line of fluid, kind of right about. It's almost this small little area right here is what we're looking at. So if I was measuring that, it's really small, right about 2 millimeters or so is the distance on there, which is normal. If you start getting fluid therapy, a lot of times you'll start seeing them a little bit higher, maybe 3 to 4 millimeters or something. If I start getting more than 3 to 4 millimeters, that's really making me concerned. So again, there's that little black line kind of right here. That's our renal pelvis in our transverse view. Sometimes it's easier to get that view in transverse and see the renal pelvis that way than trying to do it on a sagittal view. So that's what we're going to do if we're looking at the renal pelvis. Different changes that we can see. Renomegaly, if I start seeing really, really big kidneys and maybe a small liver, making sure we don't see any evidence of a shunt anywhere or something we can look for. Cats, when we're examining them, a lot of times we're looking for like chronic kidney changes. We'll see a lot. So before we can really see that distinction from cortex from here to here and the medulla from here to here, right? Really easy to see that difference in the hypoechoic region to the hyperechoic kind of cortex. If we start losing that really nice distinction and the kidney kind of looks more the same echogenicity from the medulla area to the cortex, we call that decreased corticomedullary distinction, and that can be a common change we'll see with degenerative or chronic kidney changes. If we're seeing any infarcts, a lot of times you'll get that fibrosed cortical tissue will look hyperechoic and sometimes even be in a pyramidal shape along the cortex. That happens because it might have been one of these arcuate vessels blocking off the blood supply to that one area within the cortex, and that can shrink it down a little bit and make it hyperechoic. So we can look for changes like that. We can look for calculus or mineralization within the cortex. That's kind of common, especially with degenerative changes. We can see renal cysts. So if there's anechoic little black areas along the cortex or anywhere else, cyst being a free fluid normally gives us some enhancement distal to the actual cyst while we're imaging it. So it actually looks brighter, just distal to the cyst. So we can look for those changes. Of course, we can look for any masses like a renal carcinoma is possible on these guys. Polycystic kidney disease, if it's a Persian, you might see tons and tons of cysts on those guys. Masses, renal carcinomas, hemangiomas, things like that. Hyperechoic masses, maybe some metastatic diseases are sometimes a little bit more hyperechoic sometimes. You'll hear people talk about a medullary rim sign, so this hyperechoic rim along the medulla of the kidney. Some animals, it may actually just be normal, but others we can see with some other diseases out there too. So something to look for on there we can see with like lepto or FIP. Ethylene glycol toxicity is a big one with all that mineralization of like the Bowman's capsule area. I think it causes that really big medullary sign that we'll see in them. So looking for those types of changes. Small kidneys, they can have hypoplasia, dysplasia, issues with that. Cats are more uniform in their size. So if we were getting measurements and looking at the cat length of the kidney, most of them should be about 3.5 to 4.5 centimeters. So we can look for that. But again, just making sure we get the entire thing imaged, every single plane in sagittal, flip over to transverse, making sure you go cranial to caudal. See if you get a good eye look at that renal pelvis, making sure it's not dilated. Here's that renal pelvis here, that little V shape coming through.